Hello and welcome to everyone who's joining us now. We've got a great session today on frontiers in health and education service delivery. So let's get started. Our first speaker is Antonella Bancalari, who is at St. Andrews and the IFS. And she's going to be presenting a really interesting paper for us on a field experiment trying to improve infrastructure in India. So Antonella, over to you. Go ahead and start when you're ready.
Thank you very much, Martin. And thank you very much, everybody, for inviting me to present this paper titled Improving Infrastructure in Developing Cities, Experimental Evidence from India on the Service Delivery Day, and such an exciting session. So this is joint work with Alex Armand and Britta Augsburg. So let me start a little bit by the motivation. How low quality infrastructure is a common sight in developing cities. And this has terrible consequences for economic growth and public health. And these consequences can even be more severe in densely populated and low income settings, such as slums, where around 30% of the population live in. Now, improvements in infrastructure quality can generate large social returns, but deep governance and coordination problems involving citizens, service providers, and governments hinder any sustained upgrades. And these obstacles are exacerbated by a very low valuation for environmental improvements in low and middle income countries. I think somebody has unmuted themselves. Yeah, and the perception of basic services as a right rather than a service to purchase. Now, what happens is that effective prices can drop below the marginal cost of operation and maintenance when this happens, and leads to a persistent low quality equilibrium. Most evidence in the literature comes from the effectiveness of upgrading infrastructure, such as like building a brand new infrastructure or rehabilitating infrastructure, or running the last mile in terms of expanding access to the infrastructure or expanding connectivity. But there are some low-hanging fruits that are implemented by governments, but we know very little about their effectiveness, such as increasing the maintenance of an existing infrastructure and incentivizing the effort of the service provider. So that's what we do in this paper. We're asking how to improve infrastructure quality, and we run a field experiment in 110 catchment areas within slums of community toilets in Uttar Pradesh, India. And we randomly allocate each of these community toilets and their catchment area to one of the three treatment arms. The first treatment arm is what we call improvement. And here we provide a maintenance of the existing infrastructure and a follow-up incentive scheme to the service providers. The second treatment arm consists of an additional sensitization campaign among the slum residents, so trying to push a little bit on the demand side as well. And the third treatment arm is just to control. We measure the particular effectiveness of such an intervention on free riding, willingness to pay, and public health. And we collect novel and rich data on community toilet caretakers and slum residents' behavior using slum census and household census, 3 rounds of panel survey at the household level, 5 rounds of panel surveys, and observations of the percentage of users that pay and how many users are in a community toilet on a random day for a space of 1 hour at dawn when the traffic is the highest. We also conduct several lab in the field experiments. I'm going to be focusing today on willingness to pay for community toilet use, demand for public intervention in community toilets operation and maintenance, and sensitive behavior. So community toilets are gender-specific toilets, are a collection of gender-specific toilets, urinals, and hygiene facilities. They are owned by municipalities, but managed by private providers, and their operation and maintenance is conducted by caretakers. There are salient coordination problems we find at baseline that there is rampant free riding and a remarkably low willingness to pay for using these community toilets. And improving the quality in this infrastructure can have significant social returns, given that more than 4 million slum residents don't have access to a private latrine, and more than half of those are currently practicing open defecation, which has important consequences for child health, mortality, human capital accumulation, and economic growth. These are potential users of community toilets, which are in a higher step of the sanitation ladder than many other on-site private facilities available in peri-urban areas. So now let me tell you a little bit more about the treatment arms. And the first one is what we call the improvement. The improvement treatment arm consists of a one-off city grant scheme in which we provide caretakers with the following options. They can choose between us, well, an NGO offering a deep cleaning of the community toilet, repairs in infrastructure, or cleaning tools and agents, plus a cleaning training to improve the maintenance of the facility. We, 2 months after, revisit, and we tell them that we're gonna now be providing financial rewards for the caretakers. And these financial rewards are gonna be provided every 2 months, 4 times in the whole period of study of 1 year. And they have the chance in each of the rounds to get up to 1/3 of their monthly salary, conditional on us finding soap in the hand washing facilities, no feces in the cubicles, and very low bacteria. So essentially, we're incentivizing low health risk in these facilities. The second treatment arm has the improvement plus a sensitization campaign. And this sensitization campaign consists in a door-to-door information campaign in which we raise among slum residents the importance of the public health consequences from practicing open defecation, the benefits of using these community toilets, the importance of paying the fee in terms of being able to cover the operation and maintenance costs, as well as other duties of the users while they are there, and their rights when paying these fees. So finding that the community toilet is actually of a good quality. We send also monthly reminders via voice messages, we distribute leaflets, and we place posters in the community toilets throughout the whole period of the study. And this is an example of a poster that people remember the most because it's a scene of a Bollywood movie that was adapted for sanitation purposes with the help of our partner NGO. So now I'm going to explain you a little bit about some outcomes that were measured through lab in the field experiments. And the first one is the willingness to pay. And we play this game with slum residents separately for senior men and women in the same household. And the elicitation method that we use is a multiple price list in which we have a set of questions, each independent from each other. And then the participant has the option to get a bundle of 10 tickets or cash. And they give their answer to each of these options. And at the end, we have a lottery in which one of the questions is picked, and then they get paid whatever they chose in that question, either the bundle of tickets or the cash level in that question. So the willingness to pay is measured as the switching point between giving away the bundle of tickets and start receiving the cash. The second behavioral measurement is a structured community activity in which we distribute voice of the people cards to our participants, where they can mark one key issue in their community that they want to raise to public officials. The results then are shared to local public officers, so this is an incentivized method, and it essentially measures the slum residents' demand for public intervention on the following areas. And what we care about is the relative importance that they give in terms of the demand for public intervention on community toilet dirty. So that's essentially demand for public intervention on the operation and maintenance of the community toilet relative to other issues in the community. And the final one I'm going to be giving you a description of is a list randomization that we use to measure sensitive behavior. So we asked to the participants, how many of the following activities did you do yesterday? The respondent can keep secret which ones, but they just give a number of how many of those. We randomly allocate the participants to a short list, just a number of trivial activities, or a long list that includes an additional sensitive activity, open defecation, community toilet use, or hand washing with soap. The difference in means across short and long lists reveals the real behavior. So the timeline of the intervention is as follows. 2 months after the baseline, we provide a grant scheme at the in the community toilet. And then from the 4th month after the baseline, we start the financial reward scheme until the end of the study. Throughout the whole study, we provide a sensitization campaign at the household level at baseline, 2 months after, and then between 6 and 8 months after. We provide voice messages throughout the whole year, and we go back and measure 3 times for the household level and 5 times for the community toilet.
Got about 5 minutes left, Antonella.
Yeah. So now I'm going to be presenting the results in these panels. What you're going to see in the upper panel is the treatment effect, and the lower panel, the control mean. And you can see the baseline balance, then the effect at the grant period, and then the effect at the incentive period for any treatment in black, improvement in blue, and improvement plus sensitization in red. So what we find is that the grant scheme was effective. It increased the probability of receiving physical maintenance by 8%. And interestingly, the additional financial reward is what improved overall quality by 9%, and the probability of a community toilet to be considered of high standard by 66%. Now, focusing on the caretakers' behavior, we see that the financial rewards to caretakers didn't crowd out intrinsic motivation, and it did what we wanted, what is shift effort. However, the way it shifts effort is in terms of the time allocation in activities. And what we find is that there's a shift in time allocation towards management activities by 8%, which are essentially collecting the fees and supervising the cleaning rather than cleaning themselves. Throughout this period, we also find that there's a reduction in free riding by 18% compared to control means, and also on usage, but this is marginally significant. Now, we focus on the slum residents' reaction to this improvement in the community toilet, decreased free riding that we measure at the community toilet level, and we essentially are interested in understanding their willingness to pay for usage of the community toilet. And what we observe in the first panel is that right after the grant period, what I'm showing here is the inverse demand curve with a share of respondents in the y-axis and the price in the x-axis. And the grant scheme reduced the slum residents' willingness to pay by 8.7% compared to the control mean, while also increasing the probability of appreciating improvements in infrastructure quality. So that leads us to think that it's a little bit more than just willingness to pay, but who should be paying for this? And we indeed find through our Voice to the People cards that there's an increase in the demand for public intervention in community toilet operation and maintenance by 55% compared to control mean. All of these results in an observed slum residents' worsening of sanitation behavior. At endline, we find that open defecation increased by 20%. The control mean with a least randomization is 20%, but the treatment mean is 40%. And we also find that the probability of experiencing a curative healthcare expenditure during the previous month increased by 8%. So this is worsening, there's a backfire, and this is worsening sanitation and public health. And surprisingly, it happens even though our sensitization campaign improved the perceptions of health and safety risks from unsafe sanitation. The additional sensitization campaign increased this risk perception by 20%, but it wasn't enough to counteract for the effect on an increase in open defecation. So what we find is that there are challenges when improving infrastructure quality. Maintenance and incentives improved infrastructure and service quality, and the incentives shifted the caretakers' effort towards management activities, even though these were not incentivized, which adds to the evidence and the literature on the incentives, on strategic behavior. And this literature has mostly focused on multitasking and intrinsic motivation crowding out, but we're adding to this sort of strategic behavior of what do you do in order to achieve the outcome, even though you haven't been incentivized to do that. Which can have positive consequences in terms of reducing free riding, but it may also have a trade-off in terms of increasing open defecation from preventing people from using the community toilet if they don't pay. Now, the external intervention also crowded out the willingness to pay right after the grant scheme and increased the demand for public intervention in the operation and maintenance of the community toilet. Overall, this whole effect worsened public health, even when the sensitization campaign improved the awareness of public health risks from poor sanitation. Thank you very much. I look forward to your comments and questions.
Thanks so much, Antonella, for that. Next up, we have Aimable Nsabiman presenting a project on school feeding in Rwanda. Just as Aimable is getting his slides set up, I want to say, Antonella, I think that this is such a cool project because obviously, infrastructure maintenance is one of the kind of most important, but also most understudied issues, I think, in service delivery. And I love that this was a study that combined kind of good descriptives and really careful behavioral measurements on understanding like the causes of the status quo, but then also intervening on both the supply and demand side, measuring the responses on that, and coming out with this actually quite surprising and kind of counterintuitive finding about the overall impact of this, which, I think a couple of years ago, I remember you presented another paper at CSAE about the kind of ways in which infrastructural investments that we think of as positive things for service delivery can have negative outcomes. So I think it's a really fascinating line of work and a great paper.
Thank you, Martin.
For all of you in the audience, please.
Unintended consequences.
Yep. All of you in the audience, please do go ahead and stick your questions for Antonella in the chat, and we'll come back to them at the end of the session. And now, Aimable, go ahead and take it away.
Thank you very much to giving me this opportunity to present our paper with the title Food for Thought, School Feeding and Cognitive Performance in Rwanda. This is a collaborative work between myself and Justice Mensah as my co-author. Quickly, I'm going to go through some introduction. We know that food is one of the basic needs that every human being has as basic necessity, and is particularly important for children, where food play important role for their cognitive development and physical development as well. Yet many people, especially children around the world, still lack that necessity goal. And the consequence is that with the higher rate of children without food access, there is possibility of stunting and malnutrition. And this is also very critical, especially in African contexts, where we have higher level of malnutrition and stunting among the kids less than 5 years. So school feeding as one of the mechanisms to improve the quality of the education has been adopted in different countries, especially in Africa. And currently, globally, we have more than 46 countries which are practicing the programs to provide free meals to students while they are at school. And of course, this has important implications as it can reduce the hunger and malnutrition among school children, but also ultimately it can improve school attendance. Of course, if they attend regularly, they are likely to perform better during the tests. So what has been done so far in this context? Well, Yaramana and Simone in 2015, they just looked at the impact of school feeding, and they found that this has contributed significantly on absenteeism, reducing absenteeism, and also it has improved the school enrollment, according to Kremer and Vermesset. We found also some literature which shows that the school feeding has improved the cognitive performance among the school children. However, we still have limited literature on evaluating the programs, school feeding programs, especially in African context. And yet we know that there are many countries, even in this continent, which are implementing those programs, as there is a high level of malnutrition and stunting among children. And the most common working published papers are the one from Oreo, where they evaluated the school feeding in Ghana by running the experiment, but also Nikiema, she has a paper in Journal of African Economies where she evaluated also the impact of the school feeding on the performance of the kids in Burkina Faso. Now, in this paper, we evaluate the locally known homegrown school feeding program in Rwanda. And why they call so? It's because it's integrated projects where they not only provide the free meal to primary school children, but also they allow the local farmers to benefit from the program by purchasing the local produced food, so that even the local farmers, they can just benefit from this project. So in this work, the objective is to estimate the causal impact of the program on student performance. And also we provide some potential mechanisms, the way this could happen. So to achieve this, we use the unique administrative data on student test scores derived from the higher stake national exams at country level. And the identification strategy used is to look at the stage variations in terms of the rolling out of the program, and this has allowed to evaluate the program in the absence of RCT. Quick review of the key results. We found that the exposure of the student to this program has increased the test scores in all subjects, those students who have sit in national exams. I will explain later in the data. So in math, sciences, social studies, English, and Kinyarwanda, these are the 5 subjects that all 6th graders in Rwanda, they have to sit for national exam. So the second result, we found that the impact of the exposure is cumulative rather than instantaneous, in the sense that those students who got exposure few years before the exam, they performed relatively lower compared to those who exposed on the program with many months before the exam. And the next result we have seen is that the school feeding has reduced significantly the gender gap among the girls and boys in primary schools. Approximately 20% gap has gone down as a result of the school feeding. But also the study found that the absolute capacity of schools to accommodate the student would increase the enrollment as a plausible mechanism, because by school feeding, the schools which benefited from the program have received a lot of entrance of the student. Of course, they were just targeting the school feeding, while also inducing some challenge to accommodate in the available infrastructure. Finally, we computed the back of the envelope. We made the back of envelope calculations, and we find that the school feeding has resulted in long-term benefits on investing on school fee on student while eating at school. This is also very important. I will come back later on it. Now, what I'm going to explain now in the following slides, I'm going to bring the context of how this project has been going on in the country. I also quickly show the identification strategy, providing results, and conclude the work. So this program of homegrown school feeding has been operating in Rwanda since 2014, and it's targeted primary schools in Southern and Western province. It has been implemented in different stages, mainly 3 stages, where in 2014 June, 11 schools have benefited from the program in the Southern province, in Nyamagabe and in Nyaruguru district. And in January 2015, there was another of 13 schools. Later, after MOU between World Food Program and the government of Rwanda, they decided to upgrade the project to 104 schools. In those program, the World Food Program provide free food and breakfast to all primary schools in all targeted schools. I'm going to discuss briefly how we approach the question, the strategy we have used to identify the impact of school feeding. So as I mentioned that earlier, we exploit plausible exogenous variation in student exposure to the program. And this is because the project has been implemented in different stages across the schools, but also within school variations, the exposure of the student at different grade level has an impact in identification of school feeding. For instance, if we go in one school, the students who are in P5 and P6, they have 1 year difference in terms of exposure. Because if the project starts in the school, immediately every kid will eat at the same time. But then the number of months, the time we evaluate the number of months each student has got exposed on the school feeding is different depending on the time we have sat for the exam. So that's what we call the exposure. So we count the number of months before the national exam. And this is done through the calculating when each school has been starting benefiting from the program and when each of the cohort has sat for the exam. So we use the
Got about 5 minutes left, Aimable.
Yeah, we use the following baseline model where we use the difference approach. The outcome is the test scores, and the exposure is the number of months each student has been exposed before doing the national exam. And we control school year of the exam and year of birth fixed defect. We also include some controls, including gender, etc. So the variable, the parameter of interest is phi, which is the intent to basically. So as I mentioned, we use the data, the primary school result data. We have standardized the test scores for avoiding for the confidentiality. And we also use the list of the schools and the time of the implementation, both coming from the Ministry of Education, but also we carry out a survey for all over the 104 schools to get the basic infrastructure, which we use it in robustness check. So before we carry out the main result, we just carry out event study because we want to ensure that our identification strategy can be taken as worthwhile, because without analyzing the parallel trend, we may have the problem. So in that case, the assumption is that the rollout of the program is uncorrelated with underlying trends for among the schools. And to do that, we carry out the event study, and we found that there is a significant statistical differences in test scores for the student who did the exam before and after the implementation of the program. Our main result shows that the school feeding has significantly improved all test scores in all 5 subjects as I showed. For instance, if I take one with different specifications, I found that 1 month of exposure of the student has increased the test score of mathematics by 0.2 standard deviations. And we also call out different heterogeneous effects, looking at the intensity of the exposure, where we count the number of months each student would have been exposed on the program. We create 5 groups, and we find that the school feeding is cumulative, where the student who got exposed more than 12 months, increasingly they are performing much better, especially in the sciences, English and the social studies, while we find also that the students who get exposed on less than 1 year, they are not different from those who didn't get exposure. But also we call out looking at the impact of age at the first exposure, and we find that the students who got exposure at early stage, they perform much better than those who just get exposed the first time who get exposed at old level, which also implying that it's better to feed the student at early stage than later. We also call out the analysis on gender gaps, and we found that the difference is extremely high, where we found that the school feeding has ultimately improved the girls than the boys, and of course, although both of them benefited, but the girls benefited much more than the boys, indicating that better to feed, better to provide school feeding, because that also take into consideration those who are neglected by social norms like girls. So finally, we call out the mechanisms with our survey, and we find that the school feeding has improved the school enrollment, and the student-teacher ratios has significantly improved. However, it did not have an impact on class size. Finally, we call out the back of envelope calculations to see whether we could just derive a net social return on investment in school feeding. And then by using the figures we had, we find a net present value of more than 700 USD for future earnings associated with 1 year of his exposure of each student. So this also aggregated from the 85,000 students, which provides more than 59 million in total students who benefited. Can conclude by 2 lines by saying that school feeding improving the cognitive performance of the student in Rwanda, but also it provides a net social returns to public investment. And thank you very much.
Thanks a bunch, Aimable, for that. That was a really fantastic presentation. If you could stop sharing your slides now, and we'll switch up over to Alexis. And Alexis, go ahead and start sharing your slides when you're able. As he's doing that, I'd just highlight for me, the really striking finding from this study is, first of all, well, the finding itself that, like, yes, this improves students' cognitive performance. In some senses, isn't that surprising? But as Aimable said, having it documented this precisely and with this this degree of rigor from this kind of large-scale rollout of this program, I think is really valuable evidence, and provides, I think, a lot of food for thought in the context of today's broader discussions, where we're talking about lots of more complicated ways to improve education quality and that kind of thing. But it's good to remember that sometimes very simple interventions like school feeding are the most effective way to go about things. So I know I have some questions. If you do as well, please put those in the Q&A now for Aimable. We'll collect those and come back to them at the end. Alexis, over to you.
Hi, hello everyone. Thank you very much for having me and listening to me today. I'm going to present you this new paper that we've done with my co-author, Laura Moscovitz and Justin Sanderford on the long-term decline of school quality in the developing world. So I'm going to start with a bit of background and motivation for the paper. So obviously, you know, in economics of education, school quality is very important. We obviously care a lot about the fact that children are going to school, but we also care a lot about the fact that children are learning something while they are in school. And there's been a lot of effort in the past 10 or 20 years to measure better and better school quality in the developing world. There have been more and more international tests like PISA, PIRLS, TIMSS, PASEC, etc. that tells us how much learning is happening in those countries. And there's been some attempts, say for Maltinock or Sanderford, to link those tests together. So we have a better and better idea now in which countries school quality is good or which countries school quality is bad. But although we know better and better which countries are doing best in terms of school quality, so we know, for instance, that Vietnam is a good is a country where school quality is pretty good, we know very little about the long-run trend in education quality. And I say the reason for that is that most of these international tests, standardized assessments that we use to measure quality are relatively recent. But having long trends in school quality is actually very important because, you know, we know that, for instance, Vietnam has a very good school quality, but when did Vietnam start having this good school quality? Is it a relatively recent phenomenon, or is it something that has been happening in Vietnam for a long time? Does it follow a reform that Vietnam put in place at some point, or not? We also, you know, we also would like to know if some countries manage to go from a low quality to high quality, and what reforms or what did they do to do that. But without knowing the long trends in school quality, we can only know what are the levels now, and we don't really know how things have evolved over time. So that's actually the main aim of this paper, is to construct this long-term trends in school quality to try to answer some of these questions. Right, so I'm going to talk a bit more now how we're going to do that. So first, the data that we're using. So we're using the universe of DHS and mix survey, all the surveys that have a direct measure of literacy. So it's pretty much all DHS and mix collected after 2000. That makes a sample of 87 countries, 64 of them having more than one survey. We have a large sample, a very large sample for women, more than 4 million observations for women in more than 200, almost 300 surveys. The sample for men is much smaller because literacy is not systematically collected for men in DHS and mixed surveys. And for this reason, most of the results I'm going to present today apply for women. We have the result for men in the paper, but they tend to show the same as women, but I'm not going to comment them today. We actually use only 4 variables. So it's a relatively easy data exercise where we only use interview year, age of the person, the years of schooling of the person, and the literacy status of the person. So literacy, so what do we have? We have a direct measure of literacy in those DHS and mixed surveys where the interviewer is going to the household and testing people by making them read the simple 4 simple sentences actually in the reading card, the language of the respondent choosing. And then literacy is coded on a 3-point scale from not reading at all to reading well. And just something to keep in mind that neither DHS or mix test literacy for people who have secondary schooling. So we don't have actually a direct measure of literacy for people with secondary schooling, and for this reason, we can't use data for them. So that is a measure of literacy in the surveys. So how are we going to define quality with this measure of literacy? So we define school quality as the tendency for schooling to generate learning. And we measure that as the expected literacy at grade 5. So why grade 5? Because grade 5 is towards the end of primary school in most countries in the world. And we believe that's a level where most students should be able to read at this point. This is quite easy to estimate expected literacy at grade 5. You only need the literacy status of the person and years of schooling. and do a simple regression and a prediction at grade 5. And this very simple measure actually is well correlated with the harmonized learning outcome estimates or GDP per capita or education spending, giving us some confidence that, that this measure is actually a good proxy of school quality. This is, for instance, some graph showing you, how expected literacy at grade 5 correlates with GDP per capita on the left, or with spending per primary student on the right. And, as you can see, there is some correlation with these two indicators. So in countries, I mean, very simply said, in countries where like more students are able to read at the end of grade 5, seems to be countries where school quality is better. But, obviously we don't want to stop there. The aim of this paper is not to do a cross-section of school quality. The aim of this paper is really to try to get back in time. And for that, we use the fact that in DHS or mixed surveys, we have we actually observe people of different age. So we observe cohorts of people. And the idea is then to use the literacy rate of the literacy status of older people in the data sets to have a proxy of the school quality back in the time. Obviously, this approach is only valid if we think that something like literacy is relatively stable over lifetime, or at least if we can model the changes in literacy over time for people. And to do so, we exploit the fact that we have multiple survey rounds, 3, 4, up to 9 survey rounds in Senegal, on the same cohort to disentangle age and cohort effect. But I mean, another issue that we will have by doing so is we have a third dimension, coming in, is that now we observe that the same cohort interviewed at different age, but obviously interviewed in different surveys, so in different periods. And so we end up having this very well-known program in statistics, especially very well-known by demographers or sociologists, which is an age, period, and cohort model. So we have age, period, and cohort, and these 3 dimensions are perfectly collinear, and then can't be identified without additional modeling assumption. And I think here it's important to understand exactly what our model is trying to estimate and what are the different effects that we're talking about. So we have these 3 effects that we want to disentangle, and the first effect, as I said, is the age effect. The age effect, I think, is quite easy to picture. So we have people who learn how to read when they are at school, and then, what will happen during their adult life? Will they forget how to read if they don't use reading? Will they learn how to read at some point, later in life? So is the literacy status of, say, 45 years old a good proxy of school quality 30 or 40 years ago? That's what we want to know. The second thing that we have is this individual, their data have been collected in different surveys at different periods. So are those periods, having an impact on the literacy level of people? We don't think that's credible, but we think that there is a high chance that there is some survey effects. So DHS and mixed surveys, they are very good quality surveys, but obviously, you always have some survey effects that could happen. And finally, we have like this last effect, cohort effect, which is the differences in literacy between cohort, conditional unschooling in our case. And this is our measure of school quality. So this is really the effect that we want to estimate. We want to have an unbiased estimate of it. So there are different ways of breaking the problem of the non-identification of the APC model, and we settled to use the Deaton-Paxson normalization that makes the additional modeling assumptions that there is no trend in period effect, as we think that's a reasonable assumption in our case. And the way we model the different effects, the age effect, our model are linear, with a linear term and a square term. Cohort effect are fixed effect interacted with years of schooling. And so this is the model that we have. I'm going to skip that a bit. And basically we have then a set of dummies, which are survey or period, the same in our case. We have a set of n-2 dummies that are transformed as seen in equation 2. And what is important to know is this transformation makes the period effect add to 0, and there is no trend in period effect. So that's how the Deaton-Paxson normalization works.
About 5 minutes left, Alexis.
Okay. So here I'm going to skip that a bit. So we estimate our model for with at least 500 observation with people over the age of 20, and we use a Tobit. And I'm going to show you quickly, because I think it's useful, how it works with our data. So this is the data for Nigeria, for instance. So we got on the panel, this is the raw data that we have for Nigeria. So we have like a decline in literacy. And the model is showing us that, there's probably some age effect in Nigeria. People are maybe, losing 10 percentage points. Period effect years are, pretty stable. Maybe the 2010 survey as kind of 2015 have some bumps, but not so many bumps. And this is how the model then is predicting cohort effect. Quite similar to what we have in the first panel. But this is like Ethiopia, and Ethiopia is very different, where we have like these 4 surveys, and you can see that, say, people interviewed in 2000 and 2016, there's a massive difference in the, even if they were born the same year, in their literacy rate. And without surprise, the model is predicting very, very large age effect in Ethiopia, small period effect, and though predicting for this reason large cohort effect. So I'm going to jump to the main finding very quickly. The main finding is obviously we see a very large increase in literacy and access to grade 5 in a lot of those countries. But our trend in school quality, so the main finding of the paper, the trend of school quality tends to be declining, and especially declining in South Asia and Sub-Saharan Africa, whereas it seems to be stable in Latin America and East Asia, or even in the Middle East. This is an important graph in the paper. It shows the change in school quality between the cohort born in the 60s and born in the 90s in all the countries. And as you can see, in most countries, there's been a decline in school quality. And there are very, very few countries where there's been any improvement in school quality in this period. This is the gender gap I'm going to skip that. And we have a last section where, we try to reply to this question, which is, are all these declines in school quality, are they all due to selection? Are they all due to the fact that we have different student composition over time? And then we do 3 tests to try to quantify that. We don't have a good instrumental variable, unfortunately, to control for selection. So we look at the student composition using adult height that we have in the sample. They estimate the determinant of school quality, and event analysis of free primary education reforms to see the shock in enrollment. I'm going to skip the adult height result, but the only thing I want to say is that actually in 20 African countries, the female adult height has decreased over time, meaning that this is not obvious that the younger generation has been better off, have a better upbringing than the older generation. This table is maybe more interesting for selection. This is a country fixed effect model where we regress school quality on enrollment. And as you can see in column 1, when we have no control, there is a 4 percentage point decrease in school quality per decade, actually. This is the trend that we observe. And in column 2, we control for enrollment. And when we control for enrollment, we halve the secular decline in school quality. Adding repetition rate or controlling for height doesn't change the decline. So there is some evidence that the decline in school quality is due to change in enrollment, but even after controlling for enrollment or even for controlling for height, there is still a negative trend in school quality in those countries. The last piece of evidence that we have is we look at all 3 primary education reform in the developing countries, and we do an event analysis where we look at the trends in school quality before and after these reforms. So we have the result for women and men in these 2 panels. And what we find is that on average, school quality tended to decrease even faster after the FPE reform. But the results are very heterogeneous. And I mean, something to note is even before the FPE reform, there was already a decline in school quality in those countries. So you can't maybe, if FPE reforms are responsible for an acceleration of the decline, they might not be responsible for the whole decline. So that's some evidence that maybe a shock in enrollment provoke a decline in school quality, and that might explain why we have this decline in school quality in the developing world in the past 50 years. But it's important to know that we can't, with this specification, know if it's due to a change in student composition or a decline in resources per student, unfortunately. And I think this is my conclusion. I will stop here. So we show in this paper that using DHS and mixed surveys, it's possible to reconstruct long trends of school quality. We saw a long-term decline in school quality in the developing world, with unfortunately no example of a country that managing to reverse low school quality and having large progress over time. And we have some evidence that student composition plays a role in this long-term decline in school quality, but it does not explain all the decline. Thank you very much for your attention.
Wonderful. Thanks so much, Alexis. Please go ahead and hand over control of the slides over to Deepak. And while Deepak is setting up, you know, I wanted to say I find this paper and this work really exciting that you guys are doing. I think it's, you know, a very conceptually simple thing using freely available data, and then kind of doing what is, you know, conceptually a kind of simple pattern description exercise, but has such relevance for research and for policy both, and the methodological care that you go about it with, I think, is really impressive. So I think it's awesome work. I'm really looking forward to talking more about it. So everyone in the audience, please do keep your questions coming in the question box. And in the meantime, we'll hand over to Deepak Saraswat from the University of Connecticut.
Thanks, Martin, and thank you everyone for having us be able to present here. And so this paper, as you can see the title, it's about setting goals in the context of education using an experiment in Tanzania. Basically, we are seeing how far the goal setting goes in improving students' education outcomes. And this is with, it's a rather long list of co-authors. We are from Monash University, Korea Institute of Public Finance, World Bank, and me and Nishit, who's my advisor, we are from University of Connecticut. So straight away, sort of going into the motivation of why we do this and why this might be important. So goals in general, no matter what the context is, they sort of represent conscious and meaningful objectives that people want to pursue. And the reason why they want to do that is because it's believed to affect both their thought and through that, the actions. So one nice sort of anchoring point in the literature is that the goals set by an individual in no matter which context, they may serve as a reference point from which you know where you are and where you want to go. So that makes the path sort of maybe a little bit more clear. And then related to that, this is often, it's been documented in the psychology literature that it's often used as a tool to motivate oneself, increase efforts, and increase all of the inputs in terms of persistence, discipline, self-regulation, correct present bias, all of these things which would be sort of inputs in achieving better outcomes in whatever field the goal was related to. And in that sense, it sort of acts as a commitment device, weaker or stronger, that's debatable, and that's something through which, like on which the research is important. And it acts as a commitment device for individuals who are lacking self-control to increase their effort, and hopefully by doing that, they improve their outcomes.
And with that, let's just go to our very exciting Q&A session now.
Is around the psychological evidence that goals and the status rewards for achieving goals, they may have an impact on motivation and thereby they may improve performance. We test this sort of hypothesis of setting goals and the impact of recognition awards in rural Tanzania, where we set up an experiment with about 180 schools with more than 18,000 students to test the impact of setting goals on their test scores. And through the results, we want to shed light on understanding the education production function probably a little better, and the design of educational interventions around these soft nudges like goal setting. So why do we care about goal setting and recognition awards? Just building on from my discussion before, that it's been found in most lab experiments, which were done mostly in the realm of psychology, that goal setting works. They change people's behavior, and eventually through that, they change outcomes. And in that sense, the setting goals and sort of setting targets, from the policy perspective, this can be thought of as or perceived as a low cost and easily scalable intervention. And this is the reason why testing this becomes more important. And testing this becomes more important in developing countries simply because we don't have enough studies in the developing part of the world looking at this specific question or question similar to that. We do have some evidence in the Western part of the world, in US and Canada, where people have looked at, where researchers have looked at the impact of goal setting and other sort of smaller nudges along with the goal setting to see if there is any impact on the college students' performance. And there has been some studies, again, mostly in the Western part of the world, testing the impact of financial and non-financial incentives to be achieving some targets or to be performing better. But so far, we have not come across studies which are testing the impact of these soft nudges at a large scale in a developing country setup. So that's where our sort of contribution lies. For the context of Tanzania, we do this study in Zanzibar, which is a semi-autonomous part of Tanzania with a population of 1.6 million. The median age is 17 years and the literacy rate is sort of on a higher side with 84%. But where the gap sort of lies is that only half of the students, they managed to pass the grade 8 exam, and their performance in various subjects sort of varies a lot. And the lowest being in math, that only 15% of the students have done well in math or they have been able to pass math exams. And due to that, the dropout rates are pretty high, that right after the 50% of the students, those who are able to pass this, those who are not able to pass this exam, a large part of those actually drop out from the whole 4-year school cycle, which is coming up. So with that, the education policy has sort of set a key priority for the government of Zanzibar that they really want to do something about that. For the research design, this is a randomized control trial, and we have 2 treatment groups and 1 control group. The randomization, for obvious reasons, is at the school level, just to control for the spillovers. And we use 187 schools, grade 8 in those schools, and we randomly divided them into 3 treatment groups. The total number of students comes up to be around 18,000 at the baseline. We have some attrition by the end line, but it still remains a pretty high number of students for us. And then we have them more or less equally divided into 2 groups, where first treatment is just setting the goals, and the second treatment is goals plus an opportunity to have recognition awards with that. And then we have a control group. We started this study in February 2016, where we just started with baseline surveys of the head teachers and the teachers and the students' assessment on English and math. And then the goal setting came in, which I will talk about in detail a little bit in some time. And then in August, we had some basic reminders for the goals for the students so that they remember what they have signed up for. And they were told that the endline exam will take place soon after. And then finally, in October, we had the endline exam and the endline assessment with the teachers and the students. The 2 treatments which we have, first is the goal setting itself, where the group basically receives an opportunity to set a personal best goal. And what we do is that we start off by telling students, like giving students a short intervention on why goal setting itself is important. Like, why do people set goals? What is the whole idea behind that? And then after that, students set goals for a follow-up test, which is coming up in 9 months. And the goal is set in the form of how much do they think they would want to score or be able to score out of 20 on that math test. The goal setting plus recognition arm, this one has the same feature as the goal setting itself. On top of that, we tell students that if they are able to achieve their goals or they are near their goals, they'll be recognized. They will have recognition in form of certificates and plaques being given in a public ceremony. So non-financial sort of awards. And the primary outcome which we have here is basically the math test, where we took the grade 7 level math and we developed a test from that, which is basically 20 questions. And the baseline and endline questions were the same. It's just that we just randomized the order in which the students faced those questions just to have the comparability. The test was well sensitive to representing various domains, and it was very well quality checked by the local stakeholders and pre-tested. So everything was done to make sure this test is sort of capturing what it should be capturing. And when we use the test scores, we just normalize them in a standard normal form. Our secondary outcomes are more of what we can think of as inputs, which would go into probably achieving a higher test score. We asked students a lot of questions which were reported on a bunch of scales, including Likert scales or just students reporting how they used their time. And then we categorize them into these 5 categories. These are basically putting together all the relevant questions, similar questions, and forming an index of that. And these are time use, student efforts, discipline, confidence, and aspirations. The estimating equation, since it's a randomized controlled trial, it's fairly simple. We have both the treatments in there, and we control for the baseline characteristics wherever we have the baseline data for the outcome. And the standard errors are clustered at the school level because that's the level of treatment. So this is the main result that we have. And we have 2 separate arms, the goal setting and goal setting plus recognition. And then we look at the range of outcomes as I've just talked about. First, we look at from 1 to 5, we look at the inputs. And then finally, we have the main outcome, the math test score. And we just include the English test score as well, because that we did the test. But the intervention was only at the math level. So we find improvements in some of the inputs, 3 out of 5, time use, effort, and discipline. And we find slightly smaller improvements in the goal setting plus recognition arm. But these are, if you can look at the last row where we just did the F test for the similarity of coefficients, these are not different from each other. So we cannot really say if which arm did better and which arm did not compared to each other statistically. But the main finding, or the main lack of finding, I would say, is that we did not see the test scores moving. There is some positive movement, but that is very noisy. So the inputs sort of have an improvement, but they do not translate into the test score. And this sort of a finding is not uncommon in the literature. It's just that it has not been looked at in a developing country context before. So all these studies, which I've cited over here, they are done in the either US or Canada, looking at softer nudges. And they do not find impacts on test scores or final academic performance as well, while they find impacts on the inputs, which hopefully should contribute to the test scores. So
about 4 minutes left, Deepak.
Thank you. And just to account for the fact that we don't see differential coefficients in both the treatment arms, we just eventually pool all the treatment arms together in the analysis. And again, the same thing stays, that we have movements in some of the inputs, but they do not translate into a higher test score. Finally, we see the literature and we try to see if there are any heterogeneous impacts by demographics or by how students estimated their own ability. In terms of demographics, we separate the impacts by gender, and we find that the treated female students are not statistically differently in terms of their inputs or in the test scores as compared to the male students. And second, we look at the impacts by parents' exposure to English, where parents, either of the parents of the students understood English or not. And again, we find no significant difference between the treated students and the non-treated students with or without English-speaking parents. And this sort of, again, puts us into the literature in which a lot of studies depending on different contexts. For example, the first one being done in Canada, second one being done in India. they have a mix of findings related to demographics and gender. So we also sort of place ourselves there by looking at this. And finally, we have this question in the baseline where we ask students, how much do you expect to score before the baseline was taken? And we then take the difference between the expected and the actual score to sort of look at, did students overestimate their performance at the baseline as compared to how they did into the headline? And we find a huge distribution towards overestimating their performance. And we look at the test scores, or we look at the impacts by whether or not students significantly overestimated their baseline performance or they did not overestimate their baseline performance. We find things moving in both the groups, again, in the inputs and not in the test scores, but we have slightly higher impact in overestimating the baseline performance, though I would not want to push too much on that because these are obviously 6 coefficients and the differences sort of are not very large. And the way we tie these results to the literature is basically that there is some literature documenting that with high aspirations or with high sort of overestimation tendency, it comes with a higher ability to take risks, which may feed into better performance. But again, we'll be very cautious when we think about that. So finally, we have this large-scale experiment in Zanzibar, which evaluates the impact of goal setting on academic performance. We find impacts on intermediary outcomes, but we do not find them translating into higher test scores, which is consistent with the studies in many different contexts, mostly Western contexts. And then we explore differential impacts by student demographics and estimation of own abilities. And this will be my presentation. Thank you so much.
Thank you, Deepak. That was great. I think it's a really interesting and kind of careful interrogation of the kind of actual effects of what has become a really popular sort of category of behavioral intervention. And I think that you and your team have done a really great job of looking at how this actually works in practice. So thanks for that. So we're going to transition to questions now, and we've had a good number of those come in, but there's always room for more. So please do keep them coming in the Q&A window. We'll do a first go around for all of the. I'll do one for each of the panelists, and then we'll collect more. So Shruti had a question for Antonella to start off with. And then yeah. Antonella, I think you have a question as well. So after this first round, we'll come to your question for your colleague. So Shruti, go for it.
Yeah, thanks, Antonella. That was a very interesting presentation. I have a couple of questions. The first is, can you tell us a little bit more about sort of the underlying norms and expectations? Do people in this setting see community toilets as a free service that should be provided by the government? And secondly, could you talk a little bit about the shift from operations to management? I found that quite interesting, especially in a setting if there are only a few employees per toilet and these people end up doing both tasks. What does that look like in practice? Thank you.
Thank you, Shruti. Your questions are really relevant. Let me tell you a little bit about the social norms first. So in this setting, actually, we don't find that the demand for public intervention in the control group in operation and maintenance of the community toilet is as high as for other things. So they're in general expecting much more public intervention in other areas, in other issues in the community. However, once they realize that the government is actually coming and externally funding an improvement in the community toilet without the need of the user's fees, that's when they're saying, okay, so you can do it, now I demand it more. Another social norm that is important to consider here is who are the ones that should be paying. So one is the government, but even within the users, free riding is way higher among females. And there's this large prevalent social norm that it's okay, females don't pay because sanitation is a right and mostly for females because we have greater needs. So it's important to put these results in that context. We're going to conduct a little bit more of the heterogeneous effects by gender because we're finding interesting things. Now the second question was about, the shift in caretakers effort. It is indeed interesting because we are incentivizing them, like they are in a principal agent settings, they are actually the agent, and we're incentivizing them to be much more of an agent. We're incentivizing them to clean the toilet, but they are also principals in the sense that they have cleaners. And apparently what they're doing is like shifting much more the behavior towards, now I'm going to be the principal and I'm going to tell you what to do. And I'm going to be making sure that I'm collecting the fees to make sure I have the resources to keep this toilet clean so I can get the financial reward. That's the story that we're thinking it's a bit behind this change in behavior.
Thanks, Antonella. So I'd like to go now to Julius Ornberger from Imperial College London. Julius, you had a question for Aimable. Do you want to pose that to him?
Can you hear me?
Yeah, go ahead.
Lovely. Thanks a lot for this really exciting work. What I was wondering is about school feeding. What is the pathway to the effect? Does it indeed improve performance, or is it related to increased enrollment? For instance, that school feeding is a motivator to attend class, and class attendance is then the effect on school outcomes. Thank you.
Thanks, Julius, for the interesting question. As you mentioned, the school feeding per se, it has, of course, direct and indirect impact on student performance. But the first channel we can see, as you mentioned in the question, is just to help the student to attend school regularly. You know, in our developing countries, we have irregularity of the student attendance. And then, of course, this is kind of motivation for the students to attend regularly, because if they know that they are going to eat at school, especially with a special variety of food compared to what probably they get from home, then they are going to attend regularly. And that also will be jointly combined with the concentration, because he's going to eat and he's going to be focused compared to when he's hungry and he cannot really even follow what's going on. So indirectly, we just get out many opportunities by school feeding primary children, because they are going to attend regularly, having that food, but also having focus while they are in class. And all those combinations, they will just improve their performance. Thanks a lot.
Thanks, Aimable. Next up, we've got a question from Alexis for Jacopo Gabbani from the University of York. Can we, Jacopo, do you want to ask your question directly? If you're still there.
Hi, can you hear me?
Yes.
Thanks. So maybe the question is basic. I'm really not very strong on education economics, but what I understood is that it seems that increasing enrollment is associated to schooling quality going down via two mechanisms, which is the composition of students and less resources per students, possibly. I wonder whether there is any value in thinking of sort of a net delivered education, thinking that if enrollment is up 20% and then quality goes down 10%, then maybe we're still okay with it, because the overall decrease in quality is offset by an increase in enrollment. Obviously, it's useful to know that quality is going down, but I was just thinking whether the others have thought of something on those lines.
Yeah, yeah, thanks for the question, Jacopo. In our case, this net education you're thinking of is actually the literacy rate that we observe. So the literacy is a function of people going to school and people learning something in school. So we need those two things to happen. And literacy is going up, but what we see from our data is literacy has gone up in all countries in the world, not because quality has improved, but because quantity has improved. So the only reason literacy rates have improved so much in the past 50 years is actually because more and more kids went to school. And actually more of them could even know how to read if the quality had been constant. And obviously you get to the point where, you know, if at the end of primary school, let's say only 60% of the kids can read at the end of primary school, and in a lot of countries, kids will stop at the end of primary school, then you will never be able to reach universal literacy because, you know, there will be always like 40% of the children who, you know, exit the system without being able to read. So I don't know if it answers your question.
Yes, it does. Thanks very much. This is very clear, and congratulations again for the paper. It's really interesting.
Thanks for that, Jakob and Alexis. Next up, we've got a question from Rosanna Himaz from Oxford Brookes University. She said her microphone doesn't work, so I'll read it out. This is for Deepak, which is that if goal setting has no immediate impact on test scores, do you think student efforts will be sustained long enough to have an eventual positive impact on scores? Could it instead discourage students? And is there any evidence on this?
Yes, that's a very relevant question, Rosanna, and thank you for asking that. Although I may not be able to say a lot about this in this context because we did not find the test scores moving. Now, one hypothesis, as you clearly pointed out, is that things did not move much to start with, right? So it will be it's not it will be very like sort of like we'll be thinking very, very positively if we expect these things to continue in the future without any further intervention. So while we don't know if this nudge is soft enough, we do provide some evidence in that regard that the input sort of increases, but they don't translate into the final output. It seems unlikely that without any more intervention, they will be sustained in the future. And that relates to the second part of your question as well, where this can eventually discourage students. Yes, theoretically that is possible, but this is where we need sort of more research, or if we could do a follow-up, or we could do the study, if we were able to do the study for a longer period, we would have been able to, this is something which would have been really interested in looking at if this eventually had backfired, which is unfortunate but important to document. But in the current study, we cannot say much about that, but nevertheless, they are very relevant thoughts. Thank you.
Thanks for that, Deepak. So Antonella, you had your hand up earlier. Did you have a question for one of your other colleagues?
Yeah, thank you. So I'm going to follow up on the question to Deepak, a little bit more about trying to understand the intervention. And if you can tell me, I think it went very fast, so I missed a little bit how the recognition works. So is it a recognition of individual performance, of relative improvement based on your own performance, or based on your peers from the classroom? And I'm asking this because there's this whole set of literature on the blissful ignorance and how people actually can underperform if they set the goals are like, if they feel that they prefer not knowing, or if they are setting the goals that are too high, they prefer setting goals that are a bit lower. So at the end, you don't find an impact because they're setting lower goals. And also, finally, this can explain a little bit why your intervention wasn't that effective, and the recognition, mostly, even though the p-values don't differ, but it may be that the recognition is not like an additional value to the goal setting because of that, that can be backfiring in terms of peer effects. So just wondering if you can do some a little bit more of heterogeneity analysis also on like relative improvement in the classroom or things like that.
Deepak, right. Before you reply, for this round of questions, I think let's collect a whole bunch, and then we'll go once more around the panel before we wrap up to give replies to all of them, just for time's sake. So we had a question from Asi Kimu in the chat. Asi, do you want to pose your question yourself?
Yes. Yeah. The question is for Emma. Hello? Yeah, the question is for
Yes, we can hear you.
I just want to know, yeah, regarding the transmission mechanism, I wonder whether we have checked for the diet content, the nutritional aspects of the research. Does it have any effect on the cognitive performance?
Great, thank you. Did you get that, Aimable?
Thank you.
No, can you repeat? I didn't get it better.
No, in your finding, you try to check access to food can affect the student cognitive performance. So I wonder whether the content, to me, I mean, the diet aspects matters. I don't know if you try to take into account in the research and how it affects your results.
So it's a question about what is the actual food and the kind of nutritional value of the feeding.
Yes.
Yeah. Okay, great. Thanks, Sassi.
Okay.
Aimable, we'll come back to you for that once we've gathered up a few more. Zara Mansour had a question as well.
Hi. So my question is for Deepak, and it kind of builds up on what Antonella has already said. I was just curious what your priors were about how the recognition and the goal setting treatment were to work together. So for example, did you expect them to work as complements or substitutes? And how would you explain, what's your hypothesis about, so, you know, like Antonella said, the p-values aren't different, but why do you think the recognition plus goal setting didn't work as well? Thank you.
So yeah, I can. So Martin, should I go ahead with this?
No, a couple more.
Okay, sure.
So we had one from Harry Sun, who can't read it out himself. But this is a question for Alexis. I was wondering if the effects are heterogeneous between countries adopting mother tongue instruction and not after a certain grade, especially since this literacy is measured in the mother tongue. And then I'm going to add a couple more questions of my own, just to kind of abuse my privilege. Antonella, so I found it really striking how low the willingness to pay was, and the fact that this intervention made this even lower. And it seems like that's, to me, you know, almost even more than the specific impacts of the interventions. That was the takeaway that I took. And so it seems like, you know, is the implication of, I guess the implication of that seems to be that the fee-for-service model of public toilets doesn't work, and could even be backfiring. And so, you know, is there something from your study that can tell us about what a better model for this would be? Is there a way to kind of make these free at the point of access, but still incentivize quality somehow without fees? And then for Alexis, so for Alexis, you know, I was wondering, I think you have this amazing historical data set now, and there are all kinds of other changes in education policy that you could conceivably collect data on. You know, so my initial thought was looking at kind of education budgets per student over time, looking not just at whether sort of education is free or not, but what's the fee level. And I'd just love to hear your reflections on what you think the kind of next step in that research agenda is. For Aimable, I was struck by how massively cost-effective this intervention was, and I wondered, you know, why would, if this is such a cost-effective way to improve educational performance, like why would this seems like the first intervention that every government or every NGO should be doing, but obviously there's probably some heterogeneity by wealth that at some point, you know, offering food or getting additional calories doesn't incentivize attendance or doesn't actually improve cognitive performance. And so I wonder if there's something in your data that can help us understand kind of where that point might be. Let me stop with my questions there. We have 1 minute left. We can spill over by a couple minutes though. So maybe if each of our panelists wants to take just 1 minute to respond to those combination of questions. Antonella, can we start with you?
Yes, thank you very much for your question. It's indeed striking how low willingness to pay can be. And we are able to disentangle it from ability to pay due to the way that we are eliciting it. And it even crowds out right after you improve the infrastructure, although you would have expected the opposite. And the mechanism we explain is the demand for more public intervention. So that leads us to think of alternative models that involve more the action of governments to solve this coordination problem, because we know free riding is an issue. We're able to decrease it, but it's not enough. Public health behavior is an issue that is difficult for you on your own to control what your neighbors are doing if they are conducting open defecation or using the community toilet. So they are still demanding this public intervention, and that would be in the form of making these toilets free. Now, many of these toilets are free, however, they are still of very low quality. And the reason is because the subsidies are either not enough in magnitude to cover the operation and maintenance costs, so that's still leaving these toilets resource constrained. And that leads us to think about effective subsidies and that the allocation will be effective, which we know is a completely different area. And there's a lot of research on how the allocation of subsidies can also create distortions in the market. But all we know is that market forces are not effective and not driving this. And we need to think of more creative ways, perhaps conditional cash transfers or cash transfers to the ultra poor to be able to cover fees for the community toilets, and making sure that these fees definitely go to a better, a highest quality toilet. And these are things that we're discussing in terms of the policy recommendations. So it's very relevant to continue the line of research and understand better what to do in these cases.
Great, thanks, Antonella. Aimable, over to you.
Yeah, thanks a lot, Martin. Just starting on the question of ASI, of course, we have in the paper we have detailed different food content which is provided in this project, and the program provides the standardized and nutritional optimized meals, which consist of the food type that provide the balanced food diet, where we have the different foods like maize, beans, with different content of vitamins, eggplants, and other vegetables, which also part of the schools, because the schools also develop some gardens for vegetables, which also provide the complement on the standard food provided by the World Food Program. I could not specifically, we could not specifically control for that in the regulation, but we have the standard food types which have been provided in the program, and it's explained well in the paper. And your point, which is very interesting, Martin, about the cost effective, and you are wondering why each government, other government partners were not providing on road. I think that also goes with the types of the program, but also I would say that sometimes it's not implemented everywhere because it's somehow expensive for different governments, also including organizations, because we need sometimes a coherence in terms of the implementation and the consistency, and sometimes it really requires some huge investment, and this sometimes needs also to be planned ahead. Thanks.
Wonderful, thank you. Alexis.
Hi, yeah, so for the first question on mother tongue, there is a paper testing using a similar measure that we have in cross-section and finding that countries that teach in mother tongue have better results. So that's definitely something, so we don't test it in the paper, but it's definitely something we could test in the paper, maybe in a panel. And it's also important to know that indeed the measure of literacy is in the language of choice, meaning that, let's say for Burundi, for instance, we have very, very good literacy in Burundi, which is probably for most of the people in Kirundi, but Burundi is testing international assessment in French, and their results in reading are not so good. So that might be some discrepancy sometimes with other data sources. For your question, Martin, on the next step, yes, indeed. So, I mean, this paper is really about trying to build a data set, trying, to test different ways, if the measure is valid, etc. But yes, I mean, we really want to use this measure to try to understand the determinants of school quality. Education budget, yeah, for sure, that would be something to test. Unfortunately, the data are quite bad, especially if we go back in the past. I'm not sure we can do it. Mother tongue would be something we might test, or like some specific reform in some countries. We also think that, obviously school quality is also an input, notably for economic growth. So there is some work to do that, we touch in the paper. We're still exploring that about the impact of school quality on economic growth, and maybe doing some development accounting exercise. So I think that's the next step for us.
Thank you. And Deepak, you've got the final word.
Thanks, Martin, and thank you, Antonella and Sarah, for your questions. I think they tie pretty well together. So I'll start with Antonella. You asked about how they were, how the recognition was actually done, or what it was tied to. So this was for individuals' achievement. So if they met the goal which they had set, that's when they were recognized in a public ceremony with like a certificate or like something which is non-financial in nature. So this was tied to individual performance and not to the group one. But I see that in both, and then when we started conceptualizing this intervention as to what is this adding, which relates to Sarah's question a little bit to yours as well, we conceptualized it as going either ways. We have evidence in both the directions that the status rewards, or these sort of rewards, non-financial in nature, if they are tied to something which has a, let's say, I'm not getting the right word for it right now, but let's say like a morality to it, that education is sort of a thing in which you are supposed to do good. And if you're doing good, don't get recognition for that, or something on those lines. So yes, it can totally backfire in that case, that you are someone who may not want to be recognized for doing well, or you don't want to like sort of like come in the eyes of people that, yeah, this is a person who was doing good. It raises the stakes for you. So it could go either ways. And we also have evidence where these have motivated people in some other context, like when we talk about in terms of labor activities or like labor market sort of activities. So we had both the priors when we started putting this in. Now, in terms of the results, we do see that recognition doesn't do well. Again, the coefficients are not statistically different, but yes, this is visibly quite clear that they don't do as well as the other one, just the goal setting. So we have some speculative evidence as to this might actually have backfired. And to test that, we did this heterogeneity by gender, where this is more likely to be the case that girls, for example, would not want more recognition compared to, for example, boys. And we did not find much there as well. But that does open me up to this idea that I should probably not shy away from exploring a bit more in terms of heterogeneous impacts, still keeping two arms separate, to see if there is something by gender or by the students' estimation of their own abilities, just to see if that had any impact. But the students' estimation of their own abilities, or students sort of like trying to game the system by systematically trying to set less goals, we didn't find any differences in the distribution of these both the treatment arms. But I can still throw in the gender angle there and try to see that. So thank you very much.
Thanks so much, Deepak. Thanks to all four of our panelists for 4 great papers today. We've run over our time on this session now, but we've got another session starting up in just over 20 minutes on social norms and health and education. So please do join us for that if you can. And thank you for great questions and a great discussion. See you all soon.